Welcome back to Face the Nation. Robert Garrett is the CEO of Hackensack Meridian Health, the largest health network in New Jersey. His group will receive the Pfizer vaccine tomorrow and will begin vaccinating healthcare workers Tuesday. He joins us from Hackensack. Good morning to you.
Good morning, Margaret. Thank you for having me.
Well, thank you for joining us. I know New Jersey has been hit very hard by COVID-19. The governor this morning said the next number of weeks are going to be hell. That was his quote. How is your medical staff holding up? What is ICU capacity like?
Well, so far, Margaret, they're holding up well. It's really been a long haul since the COVID-19 pandemic hit us in March. As we speak this morning, we are taking care of about 900 COVID-19 patients. We've seen over 22,000 patients since the beginning of the pandemic. And just to put it in perspective, in the middle of April, when we were at peak, there were nearly 3,000 COVID-19 patients that we were treating. That number decreased to about 50 at the end of the summer, and we've seen a steady increase to 900. Our ICU capacity is getting stretched. We still have some capacity. We still have some medical surgical capacity and capacity in our emergency departments. Our biggest challenge now, Margaret, is staffing. Because during the first surge, we were able to source staff from literally around the nation. But as you've been reporting, there's a surge all over the country now, so it's much more difficult to supplement our regular staff with additional staff.
And what is access like to some of the therapeutic drugs that have been developed since the spring?
The access has steadily improved. We've been doing clinical trials since the beginning of the pandemic, but remdesivir, as an example, is much more readily available. Steroid treatment is available. Convalescent plasma therapeutics are also available. So that has really helped us with this second wave and the second surge. So we're seeing a different age distribution. So there are younger people that are hospitalized, but they are recovering without having necessarily to utilize critical care. We've been able to prevent more people from going on ventilators, but we also have more tools in the tool chest with these therapeutics. They are definitely helping.
Well, one tool you'll be receiving in the next 24 hours or so are these vaccine doses, and frontline healthcare workers, as you know, are going to be able to receive it. I'm wondering, though, how do you actually execute that in your hospital? I mean, you're describing a surge of patients. Your doctors are working around the clock. Can you take them off the clock to give them a vaccine?
Well, first of all, let me just say that we are really excited about making history here as we start to vaccinate the American people. I truly believe this is going to be the beginning of the end of this terrible pandemic. We've been planning for the vaccine arrival and distribution literally for months. We have a vaccine coordinator and a team that's been appointed. They have been working out logistics, including obtaining the ultra cold freezers, working out a distribution plan to all of our hospitals. And you rightfully point out that staffing is the biggest challenge. But I have to tell you, I've been very inspired. We are getting volunteers, as an example, private physicians in the community wanting to help us vaccinate, retired nurses that are coming back to help us vaccinate frontline team members. And also, we're working with our own medical school, so medical students will be involved in the process, as well as nursing students from various nursing schools. And also, our frontline team members, they've been through so much, but yet they are willing, and this really inspires me, they are willing to come in on their day off to help vaccinate their colleagues. Wow. So we have a good team of vaccinators, that will start. We're going to start by vaccinating team members that interact directly with patients. That'll include doctors, nurses, respiratory therapists, but will also include people who support those frontline caregivers, like environmental service aides and patient transporters. And we expect, based on the supply, that we hopefully, those frontline team members that I speak about, hopefully we will be able to vaccinate all of them over the next 3 to 4 weeks.
Okay. I know you also operate long-term care facilities, nursing homes. CVS says they were told not to begin vaccination until December 21st, even though they received the vaccine before that. The Health and Human Services Secretary told us that was all a big misunderstanding. What is the plan at your facilities? What is CVS telling you?
CVS is telling us, and this is the latest information as of this morning, is that they will start to vaccinate our long-term care residents the week of December 21st.
Okay.
So that's the latest information I have. I did hear the secretary's interview, but the latest information I have from CVS and Walgreens is that they would start on the week of the 21st.
Okay. And do you have any idea why it would take that long, given that nursing home, that the elderly are so vulnerable?
I don't really, because the CDC has clearly said that the first groups that should receive vaccine are frontline healthcare workers and long-term care
Right.
residents. So
Yeah.
I just assumed that that would start at the same time.
All right. Thank you very much, and good luck to all of your staff in the weeks ahead. We want to go now to former FDA Commissioner Dr. Scott Gottlieb. He is also on the board of Pfizer, and he joins us from Westport, Connecticut. Good morning to you.
Good morning.
I want to start on the big picture. You forecasted last week that we're not going to see peak hospitalizations for at least 6 weeks. The CDC director put an even more dire timeline on that, saying 60 to 90 days. We're going to have more deaths per day than on 9/11, than on Pearl Harbor. He was talking about on each day. How do you save lives at this point?
Look, the pressure is going to be on the healthcare system, and we need to keep the healthcare system from getting maxed out. They're not going to see peak burden on hospital resources probably until mid-January, late January. You are seeing some hopeful signs around the nation in terms of a slowing of new cases in the Midwest and the West in particular. But you're seeing an acceleration in cases in the East Coast and the West Coast. So the entire country isn't going through this pandemic at the same time. New York, California were a little later to have an acceleration in cases, so they're going to be later to peak. We are seeing some signs that there is a slowing of new cases in the parts of the country that were hit hardest the first, which is particularly the Midwest and the West. So cases are likely to continue to increase through the end of December into early January. We're likely to see a peak at some point in January, but the burden on the hospital system is going to continue for another 3 weeks past that.
You heard Mr. Garrett say there that the nursing homes he operates have been told by CVS that they can't begin vaccinations until December 21st. CVS says that's also what they were told by the Trump administration. Health and Human Services Secretary says they're wrong. Does it make any sense to you as to why they would be asked to delay vaccinating the most vulnerable?
Well, the current guidance by CDC to the two pharmacies that are going to be going into the nursing homes, Walgreens and CVS, is that they can't begin until 12/21, giving those vaccinations. They're going to spend this week getting the consents in place. Now, it's possible that they try to get into some nursing homes this week, but the bulk of those vaccinations right now, according to the CDC guidance to the states and the pharmacies, is they can't begin until 12/21. They'll work through getting the consents in place from the individual patients and their family members this week. Those weren't put in place in advance. Once they start, they're going to start with the skilled nursing facilities first, but it's going to take them 3 weeks to work through all the pharmacies. They'll get the SNFs done, the skilled nursing facilities, which are the highest acuity, probably in the first week, but it'll take 3 weeks total to get through those nursing homes. There's about 45,000 in the country, so this is a big undertaking.
I understand it's a big undertaking, but there are vaccine doses being made available before then. Why? I mean, this seems like a costly delay since the elderly are so vulnerable.
Look, it's a very costly delay. There's 50,000 new infections in nursing homes every week right now, probably more than that. And we know 20% of people in the nursing homes who are infected will succumb to the infection. So there's a lot of death happening in these nursing homes. I think the critical issue is that the consents weren't in place. You have to consent the patients. They want to get all the consents in place before they go into the nursing homes. Why? Because they didn't do it in advance. I think they could have. They could have provided a fact sheet. They could have cleared a fact sheet with the FDA, maybe provided a limited emergency use authorization just for the nursing homes to get that information cleared so they could have properly consented patients. That wasn't done. We are where we are right now, but that needs to be done this week. They need to consent those patients. And in some cases, they'll have to go to family members because they'll be dealing with patients, unfortunately, who don't have capacity to give consent for themselves. So not an easy task, but probably something that should have been done in advance.
Yeah, I mean, and don't get me wrong, it is good news the vaccine's out there, but now getting it out to the people is the really complicated part. And that's being left up to the states to figure out. I know you talked to governors. What are the biggest choke points?
Well, the last mile problem is really the complexity here. People talk about the cold chain, but the logistics in this country are very good. Pfizer, which I'm on the board of, is shipping in a box that can keep these vaccines properly stored for up to 10 days and can be refilled with with dry ice and kept even longer. You can keep it up to 30 days by refilling with dry ice. The issue is the last mile, dealing with trying to get into the community to get these vaccines distributed. And initially, they're going to be distributing to hospitals for healthcare workers and nursing homes. So that's a little bit of an easier challenge. You know where those institutions are. You can get to those individuals. Once they go into the community and start trying to vaccinate, for example, elderly individuals who might not be able to leave their home, they're going to have a challenge getting into those parts of the country, especially in disadvantaged communities. If you look at what's happening with the antibody drugs right now, some states aren't distributing those very evenly. I'm told some states really aren't making use of them. They haven't distributed their available supply because they've had challenges getting those systems up and running. I think that's a concerning harbinger for the challenges they're going to face with the vaccine in that last mile challenge.
The Health and Human Services Secretary said those criticisms from governors were all just a matter of politics. But you're describing real problems.
Well, look, this is happening on a bipartisan basis. I talk to and advise Republican governors, and I've talked to Democratic governors. They have challenges on the ground, especially once they get past this month. This month is a little bit of an easier task for them, and I don't mean to trivialize it. It's still a challenge, but going into the hospitals and the nursing homes, they have big institutions that they can work with, the big pharmacies and the hospitals themselves. Once they try to go into the community, that's going to be where the challenge is. I'm not sure the country's prepared to do that right now. The governors have about a month to get ready because they're not going to be doing that until January.
You've already been on the record earlier in the week on CNBC saying Pfizer did indeed offer Operation Warp Speed the option to buy more vaccine after they knew it was effective, after they'd seen the data. And the Trump administration continues to dispute those details. But I wonder what you think of the overall supply question right now and whether there is adequate supply to meet that target that you heard the HHS secretary say, 100 million people vaccinated by February.
Look, I can't speak for the supply beyond Pfizer. Pfizer has manufactured most of the doses that they're going to deliver in December. So they said they'll deliver 25 million doses to the United States, 25 million outside the United States. Most of those doses have been manufactured at this point. They've committed to deliver up to 100 million doses by the end of the first quarter of next year. And I believe they'll hit that target. I'm pretty confident the company's going to hit that target. Beyond that, you know, Pfizer hasn't secured an agreement with the U.S., and I can't speak to the other manufacturers.
Right. And I know that the secretary has said they've been talking since October about buying the supply that still exists on Pfizer's shelves, so to speak, or in terms of what they could do this year. Do you understand what the secretary was talking about in regard to exports and supplying the vaccine outside the U.S.? The president continues to say Americans need to get it first.
Well, look, the federal government has all kinds of authorities they can try to invoke. I'm not sure what they're prepared to do. This is a global supply chain. There's vaccines being shipped into the U.S. and there's vaccines being shipped out of the U.S. and there's ingredients being shipped into the U.S. globally. So I'm not sure that they want to step in and try to disrupt a global supply chain where we're dependent upon other nations as well. But it remains to be seen what they're willing to do. They have an they had an opportunity. They have an opportunity, at least with respect to Pfizer, to contract for more. This is an American company. I'm sure we'd like to work with the federal government, the U.S. government.
Right.
And so the company stands ready, and I'm sure the other companies do as well.
All right. Dr. Gottlieb, good to talk to you again today. We'll be right back. In October, we spoke with voters around the country ahead of Election Day, and we wanted to check back in with some of them about their willingness to get the coronavirus vaccine. Now that the FDA is endorsing the vaccine, does that make you more willing now to take it?
No.
Why?
No. It's too rushed. It's too rushed, and there's just too many question marks still for me. Like how effective it's going to be, how long it will actually protect you. And I'm afraid that it's going to give people a false sense of security. The social distancing, I think, will stop. People will stop wearing masks. They'll just think they're protected. So I'm really concerned.
Mildred, you were reluctant before to take the vaccine. Given where we are now, have you changed your mind?
I haven't changed my mind. My biggest concern is how, money has entered the equation. When you have money, pharmaceutical companies and politics, it's a scary scenario for me. I have concerns It's not really fear, it's concern and cautious. I'm very cautious.
Gotcha. And Lori, you had said because of underlying health conditions for you, you were extra interested in the availability of this vaccine, and you would definitely take it.
Yes, I have so many more concerns about what would happen if I contracted the virus than what might happen from a vaccine.
And JR, you were also hesitant. You didn't necessarily trust that the government would be giving you something that is safe. Do you still feel that way?
Oh, of course, I still feel that way. I don't know what's in the drug.
What would change your mind?
I will go talk to my doctor in January. Last year, in December, I was very sick. My wife was very sick, and my oldest son was very sick. And on Christmas Day, we couldn't even have Christmas together. And so I went to the doctor like 2 days after Christmas, and they said, you don't have the flu. We tested for that. You don't have bronchitis, which you get every year. We tested for that. So since we have spoken, I went back to talk to my doctor in late October. He said, I believe you had the coronavirus. We just didn't know what it was. So let's take a test. Took the test, have antibodies for it.
Wow.
So, yeah. Would I take the vaccine? Yes, eventually. Yeah, I would take it. But not right away, no.
Beth, you were more than willing to take the vaccine, even though you weren't necessarily living in fear of this virus. You said you'd still be willing to take it.
No, I'm actually going to continue to rely on my own immune system. I firmly believe in taking control of your own health. I have been very ill. I live with disease now that I will always have. And keeping yourself healthy and free of pre-existing conditions is probably the best possible thing you can do.
Lori, you were a Biden supporter. If I remember correctly, Walter, you supported President Trump. The two of you are the only ones from this group so far who say that you trust the government and trust this process and would go ahead with the vaccine.
Who said I trusted the government? I'm from the government. I'm here to help. I run into the night screaming. No, I listen, I don't know enough about the vaccine contents. I do realize they had this understudy a long time before the pandemic struck. If you're going to trust anything, trust the fact that the pharmaceutical companies want to make money. They sure don't want to be set back. And what a disaster would happen if these things came to market and were at best not functional, at worst harmful. So in that I trust.
It's not necessarily the government that I trust in this situation, but I believe scientists and epidemiologists. I have a pre-existing condition that I was born with, and I can't do anything about it. And I have a lot of living left to do. And I really, if there's anything out there that can help me get back to my normal life, which I miss quite a lot, I'm going to do it. Yeah. For me, I have severe asthma, and my lungs are at 59% of their capacity without medication, and I can't do anything about that except take medicine to help with that inflammation.
Statistically, it is Black and brown Americans who are getting hit the hardest by the COVID infections. There is concern that that Black America in particular won't be willing to take it.
I don't think we're not going to be willing. I think it's more like we just going to be reluctant and want to take the time to make sure that the side effects and everything is okay.
So you want to wait. Jill, for you, and I know you've already said, as a healthcare worker, you would arguably be one of the first in line, but you're skeptical of this.
I love the job that I have. If it's required for me to keep that job, to have the vaccine, it's done. I'll roll up my sleeve tomorrow, Would I willingly do it? No, but if it's what, it would take, then, of course I will, because there's some things that are mandatory for us and we don't have a choice as healthcare workers. You do what you have to do, but I wouldn't go stand in line and sign up for it, just to volunteer for it. Absolutely not.
And we'll be right back. President Trump continues to contest the election despite losing the popular vote, the electoral vote, and approximately 50 court challenges in almost 6 weeks. Tomorrow, the Electoral College meets to cast their ballots, and the last step is for Congress to finalize that result on January 6th. CBS News Elections and Surveys Director Anthony Salvanto has some insights as to why Trump voters want the president to keep fighting to overturn the election. Anthony joins us this morning from Westchester County, New York. So, Anthony, every state has certified the election results. Every vote's been counted, some recounted. Why do some Republicans continue to insist on overturning the results?
Well, morning, Margaret. So a majority of voters describe the election now, 1 month on, as over and settled, time to move on. But 8 in 10 Donald Trump voters say it should still be contested. Now, why is that? Well, a similar majority of voters call Joe Biden the legitimate winner, but 8 in 10 Donald Trump voters say they do not see him as such. Now, why is that? Well, it's more than just maybe a typical frustration after an election loss from partisans. Donald Trump's voters take his word that he has evidence of irregularities, evidence of fraud in the election, casting that doubt on the process, not just the outcome. And so, looking ahead to that Electoral College vote that you mentioned, once they do vote for Joe Biden, it is half of Donald Trump voters who say that the president should still, after that, not concede. Margaret?
And Anthony, we should note that no evidence of widespread fraud has been shown to date, and the Trump campaign has been unable to substantiate its claims. Good to see you again. We'll be right back. That's it for us today. Thank you for watching. Until next week, for Face the Nation, I'm Margaret Brennan.